Good morning, everyone. Today we're going to be doing a little tutorial on pediatrics. So go ahead and come with me. I have a little setup over here that has to do with peds. So let's get to it. So what do we have here? We have a doll that's going to go ahead and represent our actual visual continuity for peds. In this case, the gender of this particular baby is a male. How do we know? Clearly. What we have here is a scale. The scale that we have here is a manual scale. As you can see, it's not a digital, therefore when you place the baby on there, it's not going to go ahead and give you the number. You will have to calculate the pounds along with the ounces on this. Along with it, the importance of a blood pressure, where a blood pressure is taken on a baby and on an infant in the hospital is taken on the lower half of the leg. And of course, as the child gets older, 3 years and older, the blood pressure is taken on the brachial every year for the yearly checkup. And of course, I have different sizes to go ahead and show for visual. Along with it, we have a pulse ox. This is the one that checks for pulse ox saturation in the blood. How this goes about is you were to go ahead and open it, wrap this adhesive around their toe, and the cartridge in itself will be adapted to the machine. We have this in itself. This is to go ahead and collect urine on an infant. And how so? This is the bag. This is the adhesive. You were to go ahead and peel the adhesive, apply this to the genitalia. How so? Let me go ahead and demonstrate for visual. A baby cannot pee on the spot, so therefore you will take the bag and place it directly on the genitalia and then put the diaper over the bag for the urine and give it time for the baby to go ahead and collect the specimen and then check back within 10 to 15 minutes to see if the baby has released anything. Okay, so if so, once you go ahead and see the baby, you remove the diaper and you should have some urine at the ends of the bag. Of course, you're wearing PPE, gloves in this case, and you were to go ahead and pour it into a specimen container to go ahead and use a reagent strip to check for if there's any signs of UTI, urinary tract infection. Along with it, what we're going to be talking about is how this form, which is an updated for the schedule for the vaccines or immunizations for an infant, is updated yearly. So make sure that you guys are looking on the CDC website to making sure that you have the correct one. The schedule, of course, if you were to go ahead and look at it, the dynamics, there's some that says see notes. Some children, unfortunately, are behind. So some children are behind on their vaccines, so the doctor will go ahead and determine what vaccines are going to be put on them at that particular visit and have them coming back in 2 weeks to get them caught up. Why is that? Some parents lost a shot record. There's no way of tracking it on M-Track for those recipients that are on Medicaid or government assistance for insurance, and therefore there's no way of determining if they have it or not. Of course, a parent has the right to refuse vaccinations, and if that's the case, there is a form that needs to be filled out. The form is typically in a cardstock form. It needs to be notarized and making sure that it is scanned into the patient's chart. Now, it is very controversial in regards to some parents that choose not to go ahead and have their children vaccinated, whether it be for personal reasons or thoughts and beliefs in regards to what's cause autism, which has not been proven, or for religious reasons. And of course, children that are not vaccinated are more at higher risk in regards to contracting that particular disease. Let's go ahead and continue talking about what's on the next page on this particular packet. And this is a pediatric growth chart. There is a blue one and a pink one. And this particular one, it is birth to 24 months, and it will tell you the age. Now there is another one that goes up to the age of 18 because peds is from newborn to 18. In this case, when you look at it, the very top numbers will determine the age of the child. On the left-hand side of this particular form, it will see inches and centimeters, and be sure to go ahead and notify this is length, also known as height. On the other side, you will see weight, and it'll be kilos and pounds. The graph here that you'll see determines in regards to what percentile the child will fall under. If they're at 25 percentile in regards to height, 50th, 75, that's how they know in regards to they're more prone to be tall, are they chunkier, are they at risk of obesity, or they may have failure to thrive. Failure to thrive is when a child is not making any progress and they're not growing either by height or by weight. On the very bottom is very crucial for all MAs to understand is to know and to make sure you're indicating how many weeks the mom was when she delivered the baby. Was it preemie? Was it full term? Did it exceed full term? Meaning, was it beyond the 40? Is it 42? Or is it 36 and lower, or just 38? That number will go here. Then it's gonna go ahead and ask for the stature of the parents, meaning how tall the father and the mother. That's how statistically they're gonna go and know, oh, the child might most likely take after the father or the mother, and furthermore. And then of course, making sure you're indicating the date and when you took the vitals, meaning the height, weight, and on the other side, of course, is how you measure the head circumference. Those are the three things that are graphed, which is height and length, which is, as we know, it is 1, the weight, and the head circumference. The head circumference is the same dynamics, the age, the measurement, whether it be inches or centimeters, and the graph. On the other side, you could flip it for weight. It could be front or back. So those are the three. On the female, on the girl, it's the same dynamics on the aging and the measurements, just the color is pink. Now I am aware that some charts are EMR, so some people don't even have to use paper. They just input the information and the EHR or EMR will graph it in itself. In addition to making sure that we're understanding how to read a measuring tape, whether you're using inches or centimeters, is very important that you know what is what as you're graphing it. So you want to make sure that you're not misdocumenting. Measuring tapes may come like this or just on paper, whichever the facility supplies to you guys. And then of course, the next thing is vaccines, where our babies usually get their vaccines, and how and where would be on the vastus lateralis. Now, that would be on the thigh, not on the center, but towards the side. That is the vastus lateralis. Some children, of course, that tend to be behind on vaccines, the doctor may indicate not only on both, but also on the deltoid region. So, of course, hopefully the children that you guys work with and on are up to date, so you don't feel overbearing that you have to go ahead and poke them multiple times. I hope this quick tutorial helped you guys out. If you have any questions, or you want more feedback, or if you want something else for me to go ahead and show, drop a comment.